Welcome to our Karecore University Mastermind study series on pediatric scenarios. So during our study series, we're going to get together just to learn from in a group environment about similar situations that you may come across when you're on the NCLEX exam, and then the goal is to explore, as we go further. So I always like to share this little Dr. Zeus saying, where I'll teach you in a room, pretty much I'll teach you anywhere. And the goal is just encouraging others to be engaged with the teaching. Once you're engaged with the teaching and you're there for it, I am there to support you along the way. Now, who am I? My name is Paula Glenn, and I'm super excited to be here. As we embark on our journey together, let me tell you a little bit about myself. So I'm a wife, mother, community advocate, educator, and mentor, and I also happen to hold the title of registered nurse. I've been a nurse for 22 years. I've done nursing in 3 different countries and 6 different states. I'm just entering, having people enter as we go along. I have practiced in pediatric intensive care unit, in critical care transport, education, and leadership. And so I'm here today. So I just always like to just share and comment on the road to NCLEX, as I affectionately call it, is not straight. It has its ups and downs, and it's topsy and turvy. But know that there's a beginning and an end. Okay, so we have our valleys, but we also have our mountain peaks, and so there is an end after we finish our studying process. So as we continue on your path to studying the NCLEX licensing exam, you'll need to think like a nurse. As you go through the content today, so I just encourage you to use the critical thinking skills as we and apply the Tanner clinical judgment model to each question, the judgment model that you learned in nursing school, and apply to each question and scenario. And that's not only going to help you to start thinking NCLEX, as I say, but nursing too. Okay, and that's the goal together, is to walk down that road for nursing. So we're talking about pediatrics today. So according to the 2022 test plan, for the RN and the pediatric, for the RN and PN test plan, the pediatric test part is under the client needs category. And so within that, you have your physiological needs and then your psychosocial needs, as well as understanding, the human needs component. It's basically scattered throughout the test plan. Now, there is a minimum of 75 questions, as you may all know, 75 questions on the exam, and a maximum of 145 questions. And then there's a maximum of 5 hours on the exam. Of course, you can take breaks, and test takers will need to complete a minimum of 75 questions in order to pass the exam. So it could cut off at 75, and many know it can cut off at 75, or it may cut off at 145. One of the major things that I like to share with people who are studying for the NCLEX is, don't worry about the number. It's understand the content and the concepts. Then that will help you better be prepared to answer the questions and to challenge anything that is thrown your way. You're not going to know everything, and that is totally okay. And you need to just be okay with that. But having a good understanding of what is on the test plan and what areas you need to study is what's really important. So out of the 145, so the maximum 145, out of actually the 75 questions, 15 of them are considered sample questions for the upcoming NCLEX exam, for the next gen NCLEX exam that starts April 1st, 2023. And I know that many are aware of that. And the future test plan is made up of about 52 of the type of questions that you have now, and then 18 of the clinical judgment model questions. So that's going to be in April. But now 15 of the questions are sample questions that they're using as a sample. So keep in mind, when you're studying and you're taking the NCLEX, the goal for the NCLEX exam is not to give you your nursing license. It is to protect the public. Okay, so as you're studying for the exam, the key thing that you want to think about is client needs and safety. Okay, so safety in all aspects, and there's different priorities. There's different rules when we're looking at safety. So just kind of keep in mind that it's to protect the public, and the NCLEX tests your entry level of judgment and understanding, and the goal for that is to deliver the safe and effective care. So I'm just going to throw a couple of stats that I like to share. And I'm not sure if everyone really knows this, and people really understand how difficult it can be. So according to the NSCDN, year to date as of September 2022, the percentage of first-time candidates that pass the NCLEX is 81% total, okay? And then the percentage of second-time candidates that pass is 44% total. So combined with first and second-time pass rates, foreign educated nurses, the combined pass rate is 66%, and that's as of September of 2022. Now, so I keep those numbers in mind and the thought process in mind, and I'm trying to understand, why is that? What is it that we can do to kind of help our students have a better understanding to pass the exam? So during the review course, we've had several different adaptations of how we do the review based on student success. Okay, so I've adapted the education, like keeping that in mind of the success rates. So I just like to share those numbers with you in general. Okay, so as we talk about pediatric scenarios or pediatrics, so there's a couple things to keep in mind when you are studying the pediatric section of the NCLEX. So the area includes growth and development considerations. So understanding growth and development theories as it relates to age, and we have a couple of slides on that. Vital signs. What are my normal vital signs so that I always teach people that if you understand what your normal is, then it is easy to know what abnormal is. So understanding your normal, knowing the baseline of normal, and then understanding what is abnormal, and then what interventions you need to do to help support safe outcomes and positive outcomes for the patient. So the NCLEX world is perfect. There's, I would say it's a perfect hospital, perfect outcome. So that's what you have to keep in mind. And but knowing what your normals are will help you to understand what is normal, whether it's high or low, whatever that looks like. And also, like, knowing within the vital signs that are normal, what is too low of a blood pressure? Like, how do you assess an accurate blood pressure of, say, an 8-year-old versus an 8-month-old? So understand and knowing, you need to know what that looks like. Okay. The other thing I want to point out is reviewing pertinent data as it talks about medication. So in the adult world, regardless if you're in healthcare, excuse me, often I've spoken to many, they're usually in a healthcare related field. That's something that I will always say, like going into nursing school. Excuse me. One other thing I didn't tell you ahead of time is that this week I've been down and out with upper respiratory infection, and I've had to cancel class early this week, so I may start coughing every now and then, so please excuse that. But so when I think about medications for pediatrics, in the adult world, it's usually just a standard dose. So we're standard dosing based on medications. Maybe there's some changes that you need to do based on their diagnosis. If maybe someone has liver function disorders, or if they have kidney disease or kidney impairment. Now for pediatrics, majority of, or pretty much all of the medications are based off weight. Okay, so understanding how to calculate medications based on weight is something that's important and that you'll need to know, because that will be on the NCLEX exam. Okay. And then also lab results, and then also indications for that and potential interactions for medications and procedures that need to be done. So there's two key issues in pediatrics that we come across, and that's your respiratory distress and dehydration. Okay, I'm going to go ahead and read off just a couple of disease processes that you need to know in pediatrics. Now, we definitely don't have time in this hour together to go through all of that, especially in depth. But I'm just gonna read off a couple of systems so that you have an idea of what you actually don't know. And if something doesn't, jump out at you and like, oh, I know that, or oh my gosh, I don't know anything about that. That's definitely something you want to write down and then further study content related to that. So for pediatrics, when we're looking at the cardiovascular system, you want to know about cardiac defects, what that looks like in Kawasaki's disease. So that's those two disease processes are on the NCLEX. Respiratory, we're looking at bronchopulmonary dysplasia, acute otitis media, acute pharyngitis, tonsillitis, ear croup syndromes, and then bronchiolitis and RSV. Bronchiolitis and RSV, and they say never say never, never say absolute, but you need to understand what RSV is and the difference and what that is, and then also your your safety precautions, infection control related to RSV. That's definitely something that you need to know. Aspiration of foreign body substances, and then also what to do in case of poisoning. Asthma, epiglottitis, cystic fibrosis is important as well. So when we look at neurology, you want to know about hydrocephalus, increased intracranial pressure, neural tube defects, cerebral palsy, Down syndrome, Reye syndrome, and some contraindications with certain medications for that specifically. Meningitis and encephalitis. How do we treat that? How do we diagnose it? What are some nursing interventions related to that? Precocious puberty and diabetes mellitus. Diabetes mellitus is something that I urge you to understand inside and out. How it is, the pathology of it, as well as how we use medications to treat it in our patients and nursing interventions. So when we're looking at GI, you're looking at your tracheoesophageal disorders, your fistulas, atresia, cleft palate and cleft lip, imperforate anus. What is that? What does that look like? Biliary atresia, celiac disease, gastroschisis, umbelliceals. Then when we look at GU, it's the excuse me, chronic nephrosis, Wilms tumor. What does that look like? Any kind of genitalia problems, and musculoskeletal fractures. Fractures are standard for any type of condition. And then how do you manage cast care, as well as if your patient's in traction, what does that look like? And what are some potential complications related to fractures? Okay. As far as the hematology system, you want to know about sickle cell anemia, thalassemia, and HIV. Oncology, what are some of the leukemias? Your brain tumors. Ewing sarcoma is something that comes up. When you're looking at the skin, we look at acne, impetigo, eczema, dermatitis, different types of dermatitis, burns, cellulitis, and scales. So we're going to cover some burns today when we're looking at a couple of our case studies. And then also abuse. What is your role in managing abuse for pediatrics, the pediatric population? Okay, so those are basically, in a nutshell, the topics that you need to know. If you don't know them intimately, then that's something that definitely you want to write down and study. But the two key issues in pediatrics that come up are respiratory distress and dehydration.